Good afternoon. My name is Bill Pierce. I'm here with my partner, Dr. James Yao, as part of the history project of the Society for Vascular Surgery. The project was conceived by Dr. Jim Yao and assisted by Dr. Norm Rich and Dr. Roger Gregory. The idea behind the history project is to interview those individuals who played an important role in vascular surgery. And we're obtaining an audiovisual history that gives us a particular insight into the thought process of those people who shaped our society and our specialty. And we're fortunate to interview Dr. Robert Smith III today. Dr. Smith is an emeritus professor of surgery at Emory University in Atlanta. Dr. Smith obtained his undergraduate degree at Emory University, where he was Phi Beta Kappa. Dr. Smith was also a medical student at Emory University, where he graduated AOA in 1957. When he finished his medical school, he then went to Columbia Presbyterian University Hospitals for his straight surgical internship. Following that, he spent 2 years in the Army as a medical corpsman. Following that, he returned back to Columbia Press, where he finished his residency with Dr. Blakemore and others, and finished in 1966. He came back to Emory in 1966 and became faculty member in that year. He stayed here ever since, and he rose to the level of professor in 1977. Dr. Smith is well known within the vascular surgical community as well as nationally. He has played an important role in many societies. He was president of 7 of those societies. He was president of the International Society for Cardiovascular Surgery, one of the parent organizations of the Society for Vascular Surgery. In addition, he was president of the Southern Surgical and Southern Vascular Surgical Societies. It is my honor to be here today with Jim to interview you. He's certainly a dedicated educator, scholar. He's played numerous roles here at Emory. In addition, and I think his most important aspect is that he's been married at the end of this week, 60 years to Flo. He's a father of 3, grandfather of 7, and 2 1/3 great-grandchildren. So we're very pleased that you're here today, and we get to review your spectacular career in history. And I think most of us would agree in vascular surgery that you are a true gentleman surgeon and that you've won numerous accolades in many fronts. And I'd like to start by asking you, how did it all begin?
Well, first, let me welcome you and Jimmy to Emory, and to express gratitude for the opportunity to participate in this history of vascular surgery. I was fortunate to be involved in that during the second half of the 20th century, and I think it was during the infancy and growing up period of vascular surgery, and I've had some amazing colleagues along the way. As to how it began, I was born in Atlanta in 1933 and attended public schools, and then, as you've said, Emory College and Emory University School of Medicine. I decided in my junior year of medical school that I wanted to go into surgery, and I was fortunate to get a position as a straight surgical intern at Presbyterian Hospital in New York starting in that year. After my internship, I served 2 years in the Army Medical Corps, as was required at that time. Male physicians had to do 2 years of military service, and then returned to Presbyterian to complete a residency program for an additional 6 years. After that, I came directly back to Emory and was under the chairmanship of Dr. J.D. Martin, who was a general surgeon, had done his entire career here at Emory, and was like a father figure to me, and supported me in every way he possibly could. My first duties here at Emory were shared between Grady Memorial Hospital, which is our main teaching hospital for the medical school, and the VA Medical Center. After 3 years between those 2 hospitals, I was asked to be the chief of surgery at the VA hospital. and I served in that capacity for 20 years, dividing time between the VA and Emory University Hospital as a member of the Emory Clinic. As time went by, I had more administrative duties. I served for 1 year as interim chairman of the Department of Surgery, and after that for 15 years as associate chairman under Dr. William Wood. For 11 of those years, I also served as medical director of Emory University Hospital. And as you've said, I have had other official relationships with various organizations, regionally and nationally as well.
Tell me where you were born and what your mom and dad did.
I was born in Atlanta. My parents separated when I was an infant, so I really never knew my biologic father. And my mother remarried when I was 7, so that dad was the one I admired and grew up under. And he was an inspiration. They were both middle-class people, and they both worked full-time. I lived in a large house with my grandparents and my parents. I had a scholarship to Emory College, but at that time there were no scholarships for medical school. And the pastor of our Methodist church in Atlanta, where I had attended my entire life and still do for that matter, arranged for an anonymous donor to pay my tuition to medical school. So my parents, of course, would have borrowed that money, I suppose, if they had to, but it was a very kind gift. When we later found out who the donor was and volunteered to pay him back over time, he said, no, just do the same thing for someone else.
Where did the passion for excellence and the work ethic come from?
I guess that's partly genetic, partly learned, and it's in one's personality, I suppose. I don't know of any one thing that made me wish to excel academically and otherwise. I was a musician as well as a student. Also, along the way, an Eagle Scout, which I guess is another example of one being driven to a certain level. But it's been characteristic. I guess I could rightly be called a workaholic. At least that's what my children would say about me, that I missed too many soccer games and piano recitals along the way.
What pulled you towards medicine, of all the different fields?
That is easy for me to say because I was inspired by our family doctor, who also went to medical school at Emory, graduated in 1924, and after 2 years of training at Grady, he went into private practice as a general practitioner, surgeon, obstetrician. He did everything. He delivered me when I was born. He was my pediatrician, made house calls anytime there was a need. And he took my appendix out, actually, when I was 21. So he was my idol, and I'm sure that he's largely responsible for my getting into the medical field.
Now, you spent your whole life in Emory, except for this little slight break when you went to New York City.
That's true.
What pulled you to New York City?
At the time, Presbyterian, in my opinion, was one of the best training programs in the country, maybe one of 10 or 12 at that point. And there was a student in the class ahead of me at Emory who had done an internship there and was very pleased with it, and they seemed very fond of him. And I think that was an important contributing element in my wish to go there.
Now we've got you up to Columbia, so I know that you and Flo will be celebrating your 60th anniversary this weekend, so you've had to have been married somewhere in that range.
Exactly.
And where did you meet and how did you fall in love?
That's another interesting part of my life. Flo and I met in the 9th grade homeroom in high school, and we started dating soon after that. That was 1947, and we were married 6 years later, just a few days before I started the medical school. Of course, we've been together since then. She was the breadwinner during those years that I was in medical school, and even worked during my internship at Presbyterian. She was a receptionist at Babies Hospital at Columbia during that year. And then while we were in the Army, children started coming, and she never worked again after that. She would resent my saying that because running a household is work, I'm sure, but she never was back in commerce after that year.
There's plenty of work in a family of your size, and the family
Yes.
was very successful from what we've seen so far today. Now I'll let Jimmy talk to you a little bit more about your experience at Columbia Press.
Well, before I start, I just want to say I've been looking forward to today for a long time. I'm glad we have opportunity to talk to you.
I share that.
I would also like to thank Mr. Bob Carr for the AV service to make this possible. You sent me a photograph or the wedding picture. That's a beautiful picture.
It is. We have it displayed in our living room, and I see it daily, and it inspires me every time I look at it. You're right.
Talking about Columbia, one of the famous surgeons there, Dr. Blaymore.
Mm-hmm.
Can you tell us a little bit more about him? I read about things that he did.
Yeah. Arthur Blakemore was an icon and a very senior faculty member at Presbyterian when I was there. I'm sure he retired shortly after I left New York to come back to Atlanta, but he and Alan O. Whipple had worked together in the spleen clinic at Presbyterian for years and had developed portal decompression surgery for portal hypertension. So he was, by the time I was there, already a renowned portal hypertension surgeon. But in addition to that, he did vascular surgery. He was not a thoracic surgeon, so that was not part of his expertise. But he was the director of a laboratory at Columbia and a pioneer, I would say, in vascular surgery, because in those days before World War II, aneurysm surgery was not being accomplished with any success to speak of, and only rarely attempted. But Blakemore adopted a technique that another surgeon introduced that involved placing yards and yards of monofilament wire in the aneurysm sac to try to encourage thrombosis of the aneurysm and thereby prevent its continued expansion. And he reported on a large number of those patients. He also modified that by introducing electric current into those wires,
That's
thinking
right.
that would help accelerate the thrombosis process. I don't know that that achieved anything, and most of his patients died, as would be expected now, of a ruptured aneurysm. I think one lived as long as 2 years, but that was exceptional. He was the sponsor and helped Arthur Voorhees, whom we'll discuss, I'm sure, in some detail. Art was a trainee in Dr. Blakemore's laboratory, and together they collaborated on a number of things. Among them, the Singstock and Blakemore tamponade balloon that, of course, carries Blakemore's name. But he was a kind, patient, inspiring figure at Presbyterian.
Do you think that electric treatment and the wire is the first endovascular treatment?
Well, other things had been attempted over the years to deal with expanding aortic aneurysms, including ligation of the aorta in the infrarenal neck of the aneurysm. And some patients survived that operation. Occasionally, for some time, other things were attempted, including circumferential wrapping of the aneurysm, and a great variety of things were used over the years, fascia lata, skin, cellophane even, but none of those had the capacity to withstand the relentless lateral pressure of the aneurysm expansion. So those were all failures, the next step forward, I guess, was homographs that were introduced following World War II and were successful in some cases, but ultimately deteriorated, and most of the patients died of the failure. There was also difficulty associated with harvesting and banking of aortic tissue from cadavers, so it desperately needed to be replaced by a better technique.
Blakemore and also Jerry Lott, they do the anastomosis with a metal tubing.
Yes. I never saw that attempted. I have read about it. Metal tubing was, and glass tubing as well, were used in the effort to bridge aortic or arterial defects, but usually failed because of erosion of the artery at the junction with the firm element.
Columbia is very advanced in many ways that they have a special clinic, the splenic clinic, the liver portal hypertension clinic. I think Geyser de Teckes, he said that he learned from Columbia about those special clinics that make him start a vascular clinic at Northwestern when he was there.
That's very interesting. I was not aware of that. But
he mentioned especially while he was a traveling fellow, he went through Columbia, saw the specialty clinic, and then he modeled it. When he was at Northwestern for a couple of years.
I see.
And he opened a vascular clinic, model after this Columbia experience.
And now, of course, vascular clinics are
universal all over the place,
and necessary.
Yeah.
Yes.
Bill, you have a lot of information on Arthur.
Yeah. How did your life and Arthur Voorhees intersect? And tell us about the development of those early Vignon grafts.
Okay, Bill, that was a fortunate part of my career development, I think. Art Voorhees was a young attending at Presbyterian. He'd only been on the faculty there for 2 years when I went there as an intern. But he had already made a monumental innovation in vascular surgery while he was still a resident, actually. Art graduated from Columbia PNS at the end of World War II, and he did a straight surgical internship at Columbia where he worked under Dr. Blakemore and in Blakemore's laboratory. Art had some time between the end of his internship and the start of his military duty at the Brooke Army Medical Center in San Antonio, a number of months. And during that time, he worked in Blake Moore's laboratory. They were, among other experiments, working on a way to perform a homograph vein segment insertion into the vena cava, and that involved suspending the vein through the wall of the ventricle with silk sutures in the dog preparation. And it was during an autopsy on one of those animals several months later that Art noticed that what he describes as an errant suture had been misplaced according to the plan, was covered with a glistening covering of tissue, which he assumed was endocardium. And he had the inspiration to consider that if a single strand of fabric could be covered in that way, then maybe a textile material with multiple strands would also become covered, and the gaps between the threads would be closed by thrombus and allow the tube to be made of such fabric to carry blood. Art described that as serendipity on his part, but he, of course, had to have a prepared mind, and he was certainly fully aware of the need for some substitute vascular graft material, since it was known by that time that homographs were not going to be a permanent solution. So he presented his observation to Blake Moore, and Dr. Blake Moore, according to Art, said, "Why don't you try it, boy?" And so Art put together a tube of one of his wife's silk handkerchiefs and sewed it into a dog aorta. That was the first animal experiment of that sort, and that must have been in about 1950. And the animal exsanguinated, but the tube was still patent at autopsy. So Art was inspired to continue that route of investigation. He went into the military shortly after that, and while he was at the Brooke Army Medical Center, he was mostly involved in treatment of shock and other avenues that the military required. He didn't have much time to devote to animal experimentation, but he did attempt several operations on dogs using parachute silk from World War II, and that was encouraging enough that when he returned to Columbia to begin a surgical residency, he once more worked in Blake Moore's laboratory. And there happened to be an orthopedic resident who was working there as well, by the name of Blunt. And he had experience with plastic fabrics and suggested to Art that one that he had worked with called Vignon N might be appropriate to be used in place of silk. So Art went to the Union Carbide Corporation, and they donated to him a bolt of Vignon N fabric that had been developed as sailcloth, but they found it was so inert that it would not take a dye. So it was not suitable for sailcloth, and they allowed him to take what they had on hand. He then fashioned tubes of that material on his wife's sewing machine, actually, and started placing them in dogs, and reported in 1952 on results with about 40 animals, and 2/3 of those functioned. Those dogs were observed for as long as 8 years to determine durability of the graft. It was while Art was senior resident at Presbyterian that Dr. Blake Moore was operating on a patient with a ruptured abdominal aortic aneurysm. And when Dr. Blake Moore asked for a homograft to place in the patient, there was none available. So Art left the operating room and sewed an appropriate size tube of Vignon in, and they placed that in the patient, which was the first synthetic graft treatment for an aortic aneurysm at that time. The patient expired of exsanguination, but at autopsy the graft seemed to be functional. And encouraged by that, several weeks later, they did a second patient who recovered, and that was the first successful operation using Vignon or any synthetic. That was reported along with 17 other aneurysm operations, most of them aortic aneurysm. I think there was one popliteal aneurysm in that group. And it was amazing that of that group of 18 patients, there was a 56% survival. And that was in a period when aortic surgery was exhausting and challenging for anyone. So survival rate of that level, of course, was quite impressive. And it opened up the field for vascular surgery.
You know, telling the story of Dr. Voorhees is not too dissimilar to some of my current faculty who are on the back table sewing grafts to stents and making up the same sort of innovative, pioneering work that Dr. Voorhees did.
Exactly.
Now tell me, who were some of the mentors along your way that really inspired you? That's part of the one question. The second part, before I forget it, is when did you do your first aortic surgery?
Well, I'll answer that second part. That would have been, I guess, when I was a senior resident at Presbyterian, working with the vascular staff there. And they had a very accomplished group of vascular surgeons in 1965, that would have been. And among them were, of course, Blake Moore and Voorhees, but also Ferdinand McAllister, Sabanji Bonsley, Ralph Detterling, J.B. Price, Dick Britton, Joe Buda were all people that I worked with and under. And they inspired me to consider that as a career. But I also did a chief residency in pediatric surgery at Columbia and thought that I might specialize in pediatric surgery when I came back to Atlanta. Dr. Martin, the chairman's son-in-law, Harlan Stone, was here and was a vascular surgeon, so I knew I'd be able to compete with the boss's son-in-law. So I evolved into a vascular surgeon under leadership of my senior partner, Garland Perdue, and we'll get to that in a moment.
Well, give me your perspective of that maybe 50 years of aortic surgery, and now we're in this endovascular era. Just give me just your thoughts and feelings about that unique experience of 50 years of aortic. You've seen it go from wires in the aorta to really wires back in the aorta with stent grafts.
Yeah, it's been a remarkable experience to have been there very soon after it developed and was being spread across the country by numerous surgeons, and then to participate in its growth and see so many changes occur and so many innovations, improvement in anesthesia and transfusion and antibiotics and all of now the endovascular era, as you say. It's been just an amazing journey. But if I may, I'll add a few mentors to the group at Presbyterian, because I continue to learn a lot and be inspired by people here at Emory as well. I've already mentioned Dr. Martin, who was the chairman and recruited me back to Emory. He was replaced by Dean Warren as chairman in 1971. Dean came to Emory from University of Miami, where he had been the department chairman and also the dean of the medical school before he came here. And he served as chairman here for 20 years and promoted and developed me in every way that he could, including teaching me how to do his distal splenorenal shunt. I had already had a good bit of portal hypertension experience at Columbia, and when I came back to Emory, I sort of became the portal hypertension surgeon for the university and treated a lot of patients at the VA and also here at Emory Hospital and in the pediatric hospital across the street. But Dean was very helpful in teaching his splenorenal shunt operation, and I had a lot of experience with that operation until he told me one day that he needed my liver patients for his liver group that he was developing at the time. So I suddenly became an arterial vascular surgeon that day.
I'm sure you weren't too sad to let go of those portal hypertension patients. That wasn't an easy operation,
Exactly.
that distal splenorenal.
Yeah.
Well, Jimmy, would you like to continue?
Yes, Emory have a lot of contributions in vascular surgery. One person, Daniel Elkin, who wrote a book with Mike DeBakey on the Second World War vascular injury that changed the way how to handle artery injury. Would you tell us more about Dr. Daniel Elkin?
Yes, I'd be happy to talk about Dr. Elkin. He was, I would consider a pioneer vascular surgeon of that generation prior to mine. Emory Medical School was established in 1915, but the teaching of surgery to medical students and residents was all done on a volunteer basis until 1930. And at that time, one of the general surgeons in town, who happened to be the nephew of the dean of the medical school, was appointed the first chairman of, full-time chairman of the Department of Surgery here at Emory, and that was Daniel Elkin. As a part of his responsibility as chairman of the department, he was also chief surgeon at Grady Memorial Hospital, which at that time was and still is the main trauma center for this region. And that gave him experience in treating vascular trauma. And he became expert in penetrating wounds of the heart and published some success in the management of that problem. He also, perhaps did not introduce, but at least he expanded the use of pericardiocentesis for cardiac tamponade in some of those patients. So he was already established as an expert in vascular surgery as it was practiced in the 1930s. Another one in the South who was prominent in that respect was Rudolph Mattis in New Orleans. And he and Mattis, I guess I would say, were the chief pioneers of vascular surgery in this part of the country. When World War II started, Dr. Elkin's expertise was recognized by his being appointed to be the chief surgeon at Ashford General Hospital, which was set up at the Greenbrier in West Virginia, Greenbrier Hotel. And it was one of two centers devoted to the treatment of vascular injuries. Dr. DeBakey headed the other center. And at the end of the war, Dr. Elkin was decorated by the French Legion of Honor, among other accolades. And he and Dr. DeBakey collaborated on the book you referred to, Vascular Injuries in World War II, which was at that time the Bible for vascular trauma, I suppose. He remained chairman of the Department of Emory until 1955. So by that time, I was a sophomore medical student, and I had the opportunity to hear Dr. Elkin lecture my class a couple of times, but those are the only times I saw him. After that, he helped develop the medical school in Lexington, Kentucky, which was his home state. So toward the end of his career here at Emory, he was away up in Kentucky more than he was here, I think. So I didn't have any other opportunity to get to know him. He was followed here by a post-Korean War surgeon, John Howard, who was chairman here for 2 years before Dr. Martin was appointed in 1957.
You look at the book that edited by Elkin and DeBakey. Actually, a lot of chapters are written by Dr. Elkin rather than DeBakey.
Mm-hmm.
He wrote the introduction, he wrote the preface, he wrote majority of the chapters.
He also described a lot of approaches to arteries that at that time had not, especially those in the thorax and upper abdomen, that had not been approached surgically prior to that time.
The second surgeon is Garland Perdue, is another contributor to Emory.
Yeah.
I was recorded when he was president of the society, so I got to know him a little bit.
Yeah.
Wonderful person,
Garland was
gentleman.
Wonderful,
Yeah.
wonderful senior partner for 40 years, I guess. For me, he was in the Army, Special Forces actually, in Europe at the end of World War II, and was a decorated infantryman. Came back to Atlanta and went to Emory College and med school on the GI Bill, and stayed and trained in the Emory program under Dr. Elkin. And Elkin's junior associate was Fred Cooper, who also did vascular surgery at that point. And Garland stayed on the faculty here at Emory after he finished his training. He came on the faculty in 1957. So when I returned from residency, he was already established as the primary vascular surgeon here at the university. And he took me under his wing, taught me a lot over the years, was an amazing colleague, an innovator and an educator, great administrator. He and I together did the first kidney transplant here in the state of Georgia in 1966. He was the primary surgeon, and I did the harvesting and then helped him as the kidney was inserted. And in 1969, he established a vascular training program here at Emory, which was among the first in the country. I think Dr. Wiley had already started one in San Francisco, but the one here at Emory was the first one that was peak committee accredited in the country, and Garland took some satisfaction with that. Over the years, we've trained many vascular residents. In my own career, the number was just over 60 vascular trainees, and of all my accomplishments during my career, I think that's the most gratifying part of it, because those 60 surgeons are all practicing from California to Cairo, Egypt, and just doing remarkable work. And,
not now in Egypt.
and some of them are department chairmen. Most of them are in private practice and doing marvelous things and touching many more patients' lives than I could possibly have operated on or taken care of myself. So
True.
that's quite a rewarding aspect of care. I did a lot of surgery over the years in practice. I estimate around 10,000 operations, but and that's gratifying as well, but I think teaching and training has satisfied me more.
Bill?
Now, just to follow up on that, you know, you've trained some just spectacular individuals, and what is it about you that created the excellence in them? Tell us about your personality and how you treated those people.
Of course, this will have to be a little self-serving, I guess, but I had a retirement recognition here at Emory in 2004 before I actually stopped practicing in 2010. But at that time, we had a festschrift, and many of those trainees came back to that occasion, and I received complimentary remarks from them and from the chairman and the dean of the medical school and such as that. And they would say that I was an unusually gifted technical surgeon. They also complimented me on equanimity and patience and being a Southern gentleman, I guess, is one way to put it. In fact, one of the residents said that he had worked with me as a trainee and then as a partner for several years, and the worst that he ever heard me say in the operating room was, "Oh, heck." So I guess that's a compliment.
Well, I think you could probably say that from this side, from Jimmy and I watching you on a national level and your leadership in the ISCVS and other places. You were just a gentleman in every regards. And how do you look at the state of vascular surgery today from your leadership roles and how you've seen it transitioned?
Well, I would have to say that the progress that's been made in the years since the early 50s has just been astounding. The survival rates and the level of success that's achieved now by appropriate diagnostic and therapeutic steps is just remarkable. The progress that's occurred with, for instance, carotid surgery and stroke prevention is so rewarding. I'm not experienced as an endovascular surgeon at all because my career was coming toward a close when that became an important part of interventions. So I really can't comment from the point of view of an experienced endovascular technician, but I observed that being introduced here at Emory, and I'm aware of the progress that's been made nationally, and I understand from talking to my colleagues here that probably over 70% of the vascular interventions that are done here at this university are considered endovascular or catheter related rather than open surgical. And I'm sure that's progress. From a patient standpoint, if one can achieve the same result with a small puncture hole in the groin as opposed to a large abdominal incision, I think the patient would prefer that. I am a little concerned about how one trains vascular residents in the absence of a large experience in open techniques. I don't think it would be ethical or morally acceptable to assign a patient to open procedure if it could just as easily or perhaps more effectively be done endovascular, just as a method to increase a resident's experience. I think that's not acceptable, but I'm somewhat concerned about, as things progress, how our specialty will function 10 or 20 years from now.
Now, you were medical director of Emory University Hospital, so you've seen the administrative side of medicine as well. And how do you put that all together for the young surgeons now coming out of training? We've got the clinical piece, we've got now more and more administrative pieces in affecting our lives.
Yes, and we're just at such an important juncture in American medicine now with the Affordable Care Act and all the uncertainties that go with that, that I'm apprehensive. I'm sure we'll all survive it. I hope that the quality of care won't suffer ultimately, and we won't resort to rationing or any of those dire consequences. But my own entry into more administrative aspects occurred while I was still clinically involved, and so it was, if you want to say it, a sideline, but it was a very important part of my life here at Emory in the last 15 years of the time I served. And I think that trainees, especially those who choose to go into academic surgery, have to expect that at some point in their career they'll be called on to take administrative responsibilities. That, I guess, was important to me, but it committee meeting after committee meeting, I would not have wanted to do that full time.
Bob, I'm going to ask you a question that I know you are not really pleased to answer. This is about the American Board of Vascular Surgery. At that time, you and Jim Stanley are the two leaders for both societies. Tell me about your perspective on the independent board separation from American Board of Surgery. What's your perspective on the whole thing?
Yes, Jimmy, I'll be glad to do that. I felt fortunate to be involved in administration of Vascular Society along with Jim when he was the president of the SVS. He is a remarkable person, and as you know, at that time in the mid-90s, there was a good bit of feeling that vascular surgery deserved separate recognition as a specialty, and also the opportunity to establish the certification process within the discipline. And Jim, along with others who were leaders at that time, pushed for that. I would have to say that I was not as strong in my desire for that, because Jim was convinced that it was necessary, but I was quite willing to assist him, and he spearheaded that. I attended many meetings with him and had interviews with people on the American Board of Surgery, and of course was very pleased when we eventually achieved that recognition. And I think it's been very successful since then.
True. I think we have the 05 program. Vascular surgeons are doing all the things that they are done by vascular surgeons. So,
absolutely.
And I think now I'd like to just ask a few specific questions.
Sure.
Tell me about your mentors. Who's your number one mentor, number two?
Well, I'd have to go back to Art Voorhees, I guess, to say that he and I remained friends after I returned to Emory, and we saw one another periodically. We visited his home in West Stockbridge, Massachusetts, and attended Tanglewood concerts with him and his wife, Max. Art died at age 70 of brain metastases from an unknown primary. But by that time, he and Mags had moved from Massachusetts to New Mexico. Art had some respiratory problems, and he was able to breathe more comfortably in the arid environment. So they lived there, and Art died in Albuquerque, but Mags continued to live there, and Flo and I visited her. She was kind to give me Art's materials, his slides, and the things that were left from his practice as custodian, and that was very helpful as I prepared my remarks for the ISCBS. In fact, we were even at the point of arranging when to meet them again in Massachusetts when Art died. He was going to be there for some reason, and we were going to be in the same area. So he knew that he was going to be the main feature at the Southern Association for Vascular Surgery, but he was unable to attend that meeting because of his earlier death. But I guess I would have to say that of all my mentors, he was the one that I felt contributed the most to my development. The second, I would have to say, was Garland Perdue, who was my senior here. Garland and I never operated that much together because I was so often at the VA or taking care of my own patients here, and he, of course, had his own patients here. So we didn't spend that much time in the operating room, but his clinical judgment and diagnostic acumen and clinical know-how, just anytime you were around him, you learned something new from him. And his administrative skill, my goodness, he was just a wonderful...
He's a wonderful guy.
Presider, right. And he was one of the founding members of the Southern Association for Vascular Surgery, and was the president of that organization, and also the president of ISCBS later in his career. He's since died as well, but he made a remarkable imprint here in Emory. And then beyond that, I would have to say it was primarily department chairman. Dr. Martin, because of his mentoring, Dr. Warren, because of the years that we worked together, and then Bill Wood has been a recent chairman, and I served as his associate chairman here for the years that he was chairman. So I think I'd have to say those people.
What do you think about the merger or IS-CVS and SVS?
Well, I think it's good. I enjoyed the parallel organizations, and of course I was a member of each of them for many years and enjoyed the meetings and the camaraderie on both sides. I think that when they were separate, they made important contributions, but I think it's unifying the specialty better now to have one primary national organization. So I don't regret the discontinuation of the North American chapter at all. I think it was an important step along the way, but we've grown past that now.
Tell us something about your family.
I'd be happy to. As Bill said, Flo and I will be married 60 years in just another week, or a few days actually. And we have 3 children, a daughter and 2 sons. Our daughter has her PhD in nursing and healthcare administration. Her younger brother is living here in Atlanta and with his family, and he has worked in outpatient clinic administration, both here and in Tacoma, Washington. Our youngest child, who became the physician assistant, of course grew up in a surgeon's household, and he maintained throughout his entire high school and college period that he would never have anything to do with medicine because he said I was never at home. He wanted me to be there when he played football and soccer, and I sometimes didn't make those games. But then after he graduated from college with a degree in teaching mentally challenged children, he did that for several years, but decided that that wasn't what he wanted to do the rest of his life. So he came here to Emory and trained in anesthesia and has been practicing now for about 17 years, and it's been a great career for him. Among those 3 children, we have now 9 grandchildren.
That's wonderful.
Yeah, the last 2 came in that third child's third marriage when he married a lady with 2 daughters, so we inherited an 8-year-old and a 12-year-old in that union. And we also have 2 2/3 great-grandchildren. Most of them are in the Atlanta area, so it's
that's
great
wonderful.
to have a family like that, and to have them supportive and so available.
I have one more question, then I turn it to Bill. What would be your advice to young surgeons these days when they first start?
I have a lecture that I've given several times in different locations about almost exactly that title, Advice to Young Surgeons. And a lot of it has to do with specific aspects of vascular practice primarily, but in closing of those comments, I advise First, attention to the family, because it's vascular surgery is a all-consuming profession, and you can get too locked into it. In fact, Art Voorhees told me as I was leaving the residency program there to spend as much time as I could with my family, because he said he'd never heard of a vascular surgeon who on his deathbed said, "I wish I'd done more aneurysms."
That's good.
So I think that's important advice to any practitioner, but especially to surgeons. The second, and maybe equally important, is personal integrity. I think that that's paramount to success in any profession, but certainly in medicine, where we're dedicated to serving our patients and doing everything motivated by their welfare. And then there are other attributes that surgeons need, like perseverance and dedication to the specialty, and patience when things aren't going well. I sometimes tell my colleagues that they need to offer the surgeon's prayer, which to me is, "God, if you'll just get me out of this time, I'll never do this again."
Okay.
Yeah.
Bill?
Well, you know, we came in today from Chicago to interview you, and we were met at the airport by a wonderful young woman who's your granddaughter. And she bragged about you the entire trip here. And she gave us many stories about you, about making rounds with you, so you stayed engaged with your family. She also told us a story about you describing operations on the back of a takeout box. Maybe you could tell us about the dinners you had around your family?
That granddaughter that you just mentioned lived with us, with her family, for the first 3 years of her life. So she knew a good bit about my schedule and such growing up, but we've stayed in very close contact with Robin over the years. And for many years she lived in California, but she's back in the Atlanta area now, and we're delighted to have her. Yes, Flo and I have had the opportunity to travel abroad a lot during our years together, and one of our family events regularly was to get them all assembled to hear old granddad give another slide talk on Prague or Melbourne or someplace like that. So they've experienced a lot of those travel opportunities through what they've heard from us, I'm sure. And also heard a lot of stories about patients and hospital activities from me, I'm sure. And it's been mutually enjoyable. Yes, I had the opportunity when I retired to look back a little, and in fact, Bob Carr here did my video interview, and one of the questions sort of hinged on looking back, and at that point I said that from the perspective of retirement, that I couldn't imagine anything that I would rather have done with my life. And I guess at that point, if you can say that and earnestly believe it, you were in the right slot. And that's the way I feel.
Now, faith has played a big role in your life too, because you've volunteered in many things. You've worked in the prison ministries. You've played a big role in your church. So that's another facet that I think has probably made the man who you are.
Yes, as I've said, I've been a lifelong member of Atlanta First United Methodist Church here, and served in many capacities, administrative board and board of trustees and things like that for the church. And Flo and I have also had many experiences. We were the youth counselors for the church during the early part of our career for about 15 years, and then in more recent times I was on the board of the Care and Counseling Center here in Atlanta, and one of the assignments related to that was their prison ministry council. And as an outgrowth of that, our church took on responsibility at a women's prison here in Atlanta to sponsor the Children's Visitation Program. Once a month, inmate mothers could have their children visit them if someone could arrange the transportation, so that our church would provide the food and the supervision for that activity, and we did that for an extended period of time. Flo was in our choir at our church, and when they bought new choir robes in 2007, she donated the old choir robes to the chorus at the women's prison. And that was rewarding because several occasions after that, the chorus was invited to come sing at the Sunday worship service, and they wore the robes from our church. And we also have been involved on the board of the Metropolitan Youth Symphony Orchestra, and that's been rewarding, both to hear the quality of the music that these young people, who are all high school students, perform, but also we had the opportunity to help chaperone them on a trip to Eastern Europe, and they played concerts in Budapest and Prague and Vienna, and that was a remarkable 2-week experience.
Well, when Robin came to the airport to pick Jimmy and I up and our wives, we asked Robin, I said, why couldn't we just take a cab? We just get a cab right over there. And she said, you know, Granddad wouldn't think that's Southern hospitality to a couple of Northerners. And I think in reflecting on our interview today, you were such a gentleman and such a leader and scholar in the area of vascular surgery. And we've been honored to both be here today to interview you, and hope that you've enjoyed the time with us.
It's been my pleasure.
Thank you, Bob.
Thank you, Bill.
Well, thank you.